Life is sacred. That's why we're here, to celebrate the life and legacy of Tiffany Nicole Mofield.
In late April, Tiffany Mofield died while an inmate at the Edna Mahan Correctional Facility in New Jersey. According to her family, she'd been complaining of fatigue and difficulty breathing for weeks, symptoms consistent with acute respiratory distress brought on by COVID-19. For 10 days, a fellow inmate says, she was held in quarantine before being released back into her cell. A few days later, she collapsed. Her boyfriend, Joe Carney, used to talk to her almost every night.
And then that's one of us. She's a little younger.
From the memorial, huh?
Yeah.
Carney and the rest of Mofield's family still don't know what exactly happened to Tiffany. As far as they understand, she was never tested for COVID-19, and in the weeks before she died, never received oxygen or other advanced medical care.
When did you first hear that Tiffany was sick?
2 weeks before, before her passing, she called me and just told me, how she was feeling, breathing.
Right.
She continued to call me every chance she got, and it was like every 2 days or more, it was getting worse. And then I asked, well, what'd you do about it? She said, they ain't doing nothing,
Do you think that she had coronavirus?
I just know she always had problems with her lungs,
Right.
and it could affect her. I don't know. I can't answer that one.
I mean, part of the problem is you don't know.
Yeah, right, I don't know,
The coronavirus pandemic has been a disaster for America's prisons and jails. Across the country, more than 49,000 inmates have been diagnosed with COVID-19. 534 have died. Things have been particularly bad in New Jersey, which has one of the highest inmate death rates in the nation. Prison officials there didn't begin universally testing prisoners for the virus until nearly 2 months into the crisis. That's left a lot of families, like the Mofields, in the dark about what exactly happened to their loved ones. Miss Kaylee is a local pastor and inmate rights activist.
I mean, this has been a masterpiece of a mismanaged situation. This is what the prisoners on the inside were telling us, that they were intentionally not testing until somebody was basically passed out in their cell. We had all kinds of reports from people that are writing us saying that, we're dying in here. The Department of Corrections has been saying for months now that they are out in front of this. They have an aggressive plan. They haven't given us anything that suggests that they actually do have a routinized plan to protect prisoners, to do assessments, to isolate them in a humane way, and to release those who don't need to be there.
Is it conceivable that there are people dying of coronavirus in New Jersey prisons and the prison system will just never say that they had COVID?
That's what we're afraid of. That's exactly what we're afraid of.
Tiffany Mofield's family is worried about that too. Last month, they hired a lawyer and are petitioning the state to release her medical and prison records. The DOC is fighting the request. A spokesperson said they couldn't comment on the specifics of the case, and that the prison system's protocols are consistent with guidance from public health experts.
At least give me that closure, the one I need, the truth.
Did they do an autopsy?
I asked them, and I was told, I'm not doing an autopsy. If you want an autopsy, you have to pay for your own. I didn't have the money to get it done, so I just had to send for my daughter.
All I want is answers. That's all I want is answers from my sister.
There is some evil, thy kingdom, the power, and the glory. Amen. Amen. God.